Good morning. My name is Jude Leahy, and I am with the Oregon Health Authority, and I work in the Behavioral Health Division. And I'm here today to give you updates on two programs. One is Prime Plus, and the second one is the Save Lives Oregon, Salvando Vidas Oregon initiative. So I want to take a step back and talk about our state opioid response grant that OHA receives from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. And the reason I wanted to talk about that larger grant is because that grant underpins both of the programs that I'm going to be talking about. So that grant has 4 areas that it concentrates on: use and misuse prevention, harm reduction strategies, substance use disorder treatment, and recovery and support strategies. So what Oregon aims to do with this grant is to employ a comprehensive substance use prevention services plan. And in Oregon, we focus on school-based and youth-focused prevention programs, healthcare and community provider training and resources, and capacity building. Oregon also works to strengthen the overdose prevention and harm reduction resources delivered by the state, and that includes naloxone distribution, education, and technical assistance, peer harm reduction interventions, culturally specific and syndemic approaches, and infectious disease screening, testing, and referral. We also have 2 other areas of focus. We want to work to increase access to treatment and recovery support services, as well as expand the state's substance use disorder workforce. So the SOR grant that the state of Oregon receives focuses on regions and populations that have limited access to substance use disorder treatment and also have high rates of opioid use disorder, stimulant use disorder, and overdose. So the first program I'm going to talk about is our Prime Plus program. And I'm going to start with an overview. So what is Prime Plus? Prime Plus is an acronym, and it stands for Peer Recovery Initiated in Medical Establishments plus HCV, HIV testing and linkage to treatment. This is an Oregon-based intervention. This intervention was studied through the Oregon HOPE study and implemented first as a 3-site pilot and now as a more established program. And we're going to talk a little bit about that in a few minutes. But it is a program that was developed and studied here and translated from research to practice in Oregon. So we work with people who are at risk of or who are receiving treatment for overdose, infection, or other health-related needs that are related to substance use. And Prime Plus peer services are offered independent of engagement with substance use treatment and are non-Medicaid reimbursable services. Also, the peer services are provided by people in long-term recovery who are credentialed as peer specialists, who are trained and supported in the areas of harm reduction and infectious disease prevention. So currently, we have Prime Plus in 20 of Oregon's 36 counties. We have approximately 19 organizations, and we divide our kind of counties into 3 groups. We have a North group, a West group, and an East group. And I'll talk to you a little bit about what that means in a few seconds. But when you look at this map, the areas that are solid are the sites that are currently funded under what we call SOR 4. So this is the 4th generation of state opioid response funding from the federal government through SAMHSA. And the counties that have the lines are counties that have been in the project but are not participating currently in SOR 4. So that's Benton and Lynn and Morrow, Grant, and Malheur. So the data that we're going to be sharing about our outcome data does include those counties, but those counties are not participating in SOR 4 currently. So the types of organizations that participated in Prime Plus, we have 10 substance use disorder and behavioral health treatment agencies. We have 7 peer-run organizations, including what are called recovery community organizations. And we have 1 that's categorized as other, that is harm reduction service, public health department, community service health network. All of these organizations are established, and many had experience with peer support services prior to joining Prime Plus, though some only within the context, peer support only within the context of treatment, or some that prior to being involved with Prime Plus did not use a peer harm reduction lens. In SOR3, we added 4 peer-run organizations that are led by and serving African American, Indigenous, Native American, Latinx, Spanish-speaking, and LGBTQIA+ communities. Those 4 organizations are still among our funded organizations in counties. Oops. So I'm going to talk a little bit about the core elements of the program. So to participate in Prime Plus, we ask that agencies commit to referrals from community partners, peers doing direct outreach, and walk-ins. The peers involved in Prime Plus will support any positive change for people who use drugs. Current interest or commitment to accessing substance use treatment is not, and I repeat, not a requirement for participating in Prime Plus. Peers work with participants to self-identify their goals for health, well-being, and quality of life, and develop plans that are centered around the participants' goals. Peers provide harm reduction support and tools like naloxone and drug test strips. Peers will connect people to recovery supports and substance use treatment when that person has identified that as a goal, or when that person expresses that they would like to do that. And peers work to link people to healthcare, including infectious disease testing and treatment. Our program, Prime Plus program, supports peer specialists with lived experience to maintain their own recovery, their own well-being, and to expand their professional skills. And we ask that as a core program element and something that we expect agencies to allow to happen. And then we ask that organizations have a commitment to the harm reduction model and engagement with the implementation team of OHA and COMAGIN, which is our partner community organization that works and supports implementation. So what are the kind of services that Prime Plus peers deliver? These are kind of the top 3. They support access to resources such as health insurance and including Medicaid enrollment. Many of our peers are also sisters and can help people sign up for insurance. They support people to access community resources that meet basic needs and access harm reduction supplies like safer use kits and naloxone. Our peers provide, Prime Plus peers provide person-to-person support, including emotional and crisis support, and they support participants to reach that participant's self-identified goals. And they also help link people to different types of treatment and care, including substance use treatment, recovery, and cultural supports, physical health care, and infectious disease testing and treatment. So I'm going to talk a little bit about the infrastructure of the program. So at the top, what people in the community will see is this delivery of peer services. So Prime Plus peers in the community, meeting with people, out at events, holding events, helping people access services. Underneath that is this iceberg of training and cross-site support, resources and reporting, and enhanced supervision for peers in the field. So some of those things look like for training and cross-site support, learning. We do orientation and training for new peers and supervisors. We have monthly peer learning collaboratives that offer free CEUs that peers are required to maintain their certifications. We also hold supervisor learning collaboratives that are ad hoc that also offer CEUs for supervisors. We do drop-in technical assistance to support peers with documentation. Prime Plus documents in a database called Recovery Link that we had modified specifically for this program to track outcomes. We also provide one-on-one support for technical assistance if sites are struggling with a particular aspect of the project, either maybe intake support, documentation support, follow-up support, locating people, anything that a site might identify in the model that they're having difficulty with, we can provide one-to-one support for that. And then also enhanced supervision, and that is for peers and in the field. We also do have this cross-site sharing and project communication. We maintain a very active Basecamp message board. No personal information is shared there, but peers can ask questions of one another, seek people's input. They can communicate like, hey, I've got a peer who was transferred to a hospital in this county and they're going to return, but when I talk to them, they want to return to this other county, and can we get them hooked up so that they can stay in a Prime Plus project, but maybe not in the same county. Peers also huddle every week by region. So when I had said the East and the West and that kind of Southern, the West and East and North, that is how we group them, and they gather weekly. We also the peers have access to peer support for peer support specialists. That happens every week. Supervisors also meet by region monthly. There's also a supervisor to supervisor huddle where Prime Plus people aren't there, but the supervisors can meet together. And then we also hold an annual in-person convergence where all the sites get together and we share very, specific, answer specific questions, do panels, people get to know each other, and just provide that kind of, this is what's happened over the course of the year. We typically hold that at the end of the year, so then we can start afresh in New Year. So I mentioned learning collaboratives, and I wanted to give some examples. Here are some examples of learning collaboratives we have had. Peer role in buprenorphine induction, motivational interviewing, caring contacts, mindfulness perspectives to peer work. These are all different learning collaboratives, and the topics are typically generated by questions that are coming up in the peer huddle, the supervisor huddle, the annual meeting, or things that are just brought up where peers have suggested topics. So we have a list of topics and we work our way through them. So I wanted to talk a little bit about resources and documentation and evaluation as part of our implementation. So we have program implementation guides and topic handouts. For example, we have a topic handout on stimulant overamping. We have them when we have our monthly trainings, we record them so people can go back and look at them. We also have promotional templates so that sites don't have to design from scratch. They can grab a template and add their information. Again, our online database is Recovery Link that's tailored specifically for our projects. So we capture our participant characteristics and the types of peer services provided, whether it was a one-on-one meeting or a group meeting or an outreach meeting, meetup. We also do outcome surveys. So we do an intake survey and then we do a 6-month follow-up, and we compare from intake to 6 months changes. And then we also have site level outreach and harm reduction activities that are recorded in Recovery Link. And then for evaluation, we look at both process and outcome. We have monthly site progress reports that are compiled and sent out to sites. So instead of a site having to gather and tell us what they did, we gather the data that they've put into Recovery Link and we've told them what they've said they've done. So a supervisor will look at that monthly report to see if that matches with what they understand is happening, and we can have technical assistance and conversations around that. We publish news briefs that highlight site success stories, and then we also have an annual evaluation report. So I'm going to cover a little bit about process data and outcomes. So one of the things that we track is how people find Prime Plus. So our kind of two top engagement pathways are referrals from hospital or emergency departments, and also self-referral or referral by a loved one. So those are the highest percentage. Underneath that is peer outreach. And then when people are accessing substance use or mental health treatment. So this is some information about how many people we've served from January 2021 through September 2024. So we've served approximately 7,566 people, have participated and trusted the peer enough to give them information about themselves. A little bit over half of the people who have done that have received 3 or more contacts with a peer. So they've met up with a peer 3 or more times on a one-to-one. And overall, looking at all the sites across time, we've had about 50,500 total participant contacts with peers. So again, one of the things we measure is kind of changes from intake to 6 months. And so what we have been able to see with statistically significant difference is for people that engage and complete the survey, drug use over the past 30 days, we've seen a significant decrease in that. We've also seen a decrease in emergency visits for substance use in the past 6 months. We've seen increase in the number of people reporting that they are currently employed. We've also seen an increase in the number of people reporting that they are currently housed, and an increase in the number of people who have ever tested for hepatitis C. So finally, I'm going to talk a little bit about successes and challenges of the Prime Plus program. So some of the program challenges that we have are certainly not unique to the substance use disorder field. There's staff turnover and workforce shortages are things that we struggle with as one of the reasons, SOR supports a lot of continuing education and a lot of workforce development, because it's really important to try to decrease turnover by providing support and training. We also, our peers in the field, Prime Plus peers in the field, face community resource barrier challenges with inconsistent access to emergency departments and hospitals, a significant or lack of low barrier housing. And what I mean by low barrier housing is housing where someone can access housing first. So housing before they stop using substances. It's a lot easier to stop using substances when you are housed. Need for increased substance use treatment capacity. That is, a significant challenge when folks are ready to access substance use treatment. Sometimes it's challenging to find match them to a program that has open capacity. There are few local Hep C testing and treatment resources. So I would say more lack of local treatment resources, and some resistance in certain areas to use of harm reduction centered approaches. Also, fentanyl saturation of the Oregon drug supply has coincided with the start and continuation of Prime Plus, and this has significantly impacted both our peers and supporting peers, as well as many clients. And so really want to talk a bit about that being a significant challenge for people in recovery, working with people currently using in the situation that Oregon has found itself in the last several years. I want to close looking at our success, because the success of this program is very inspirational. We see peers making changes in their communities. They are out, they are visible, they are providing services, they are doing outreach, they are in the camps, they are on the streets, they are in resource centers. Our peers partner with other agencies and providers. They provide and deliver community and increase community support for harm reduction, because seeing Prime Plus peers in action, implementing harm reduction with the success that you get from that type of an interaction has really increased and changed hearts and minds in many communities. Prime Plus peers are distributing harm reduction supplies, engaging with new participants, helping people link back into systems that they've been disconnected from. Prime Plus has created this network of peers and peer workforce and professional development and cross-site support that is nothing short of inspirational to watch and an honor to be a part of. And I know that you're going to have a presentation or had a presentation on PATHS, which is peer-assisted telemedicine for hepatitis C and syphilis. That is an intervention that we layer on top of many of our Prime Plus sites, and it works to connect participants to Hep C testing and treatment, creating more contacts with peers. And 78% of our hepatitis C positive participants have been able to link to telemedicine, Prime Plus participants, and we've had 73 cures so far. So here is for more information. There is a website, www.peersupportoregon.org. Thank you very much.